You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, she says that nobody should be wearing a loose-fitting denture. We're talking about dental implants today, and she is Atlanta's go-to implant dentist. In fact, Georgia's go-to dentist when you want to get a brand new set of teeth. With us, we have Dr. Kelly Vaughn. Dr. Vaughn, welcome to the program.
Thank you for having me.
Now, we've had you on the program before, and I know you brought some photos, so we'll try to get to as many of those as possible. But for people that don't know your center, I mean, it's very large, who's the typical dental implant patient you see?
Really, there's two typical patients. So the first category are the people that are suffering from periodontal disease, sore gums, bleeding gums. The periodontal disease is a bone-eating disease, so it leads to tooth loss as a result of that bone loss. And then they're also suffering from badly decayed, broken down teeth. I call it almost like a domino effect. They have a big filling that turns into a crown, and then maybe they need a root canal, and then that root canal goes bad, and ultimately they end up losing the teeth. So these are people that they feel like they're throwing good money at bad teeth, and they're just looking for a solution. And a lot of places they're going to are telling them that they're headed to a denture, and that's really their only option, and they know they don't want a denture.
You don't like dentures?
I don't care for dentures, no. I think that, if you can give someone a fixed set of teeth, then that's definitely the solution. We're born with fixed teeth, and I think everyone deserves some fixed teeth.
Do you think this is the future of dentistry? Like, 20 years, 30 years from now, whenever, the dentures as we know them today won't exist, they'll all be attached to something?
I think that's where it should be headed, absolutely. Okay. Yes, I think
But you're doing that now, right?
Yeah, we're doing it now. I was going to say it's not really the future, it's now. It's just if people would come in and talk to us and see what their options are, I think they'd be pleasantly surprised. They don't have to have a denture anymore. Okay,
now I interrupted you, but you said that there was like two types of patients. So the one patient is they're possibly headed for a denture. They don't want a denture. What's the other group?
So the other group are those that were really in category 1 at some point in time and thought that they were going to be solving all of their dental problems by having all of their teeth removed and getting dentures. And now what they're realizing is what comes with dentures is a whole new set of problems.
Like what?
Your bone continuously resorbs, and with a denture, that's just accelerated. So the dentures don't fit, and they start trying to use denture adhesives, but that doesn't always work.
So the bone kind of shrinks?
The bone
dissolves
shrinks
away a little bit?
Yeah, it dissolves away, and it makes it very difficult for them to wear a denture. So their dentures are loose, they don't fit, they rub sores, and you don't know how many times I've heard someone say, I've got a denture. I've even had a patient that just came in recently. He's had 3 sets of dentures, and they're all in his bedside drawer because he can't wear any of them. So he comes to us looking for a solution. He wants upper teeth and lower teeth that don't come out.
Now you say that you could almost help the denture wearers the most with this procedure, giving them teeth that don't come in and out, but it's hard to get them in. That the denture wearers don't want to come in to do this. Why? What's your take?
I think part of it is because they're out of the loop. They haven't had teeth in some time, and there's a reason that they are in a denture now. They avoided the dentist. They don't want to see the dentist. So I think the main thing is just they're out of the loop, and that's
they don't
why
know their options.
They don't know their options. They know what they were told decades ago, and they don't know how much easier things are for them now, and they don't know the options that they have. And I think if they could just come in and talk to us, and that's why I'm here now talking to you. I'm hoping to educate people on what their options are. But I think if they would just come in and have a conversation with us, they'd be pleasantly surprised at what they find out.
And restore in 24, so I'm right. This is where they get brand new set of teeth in just 24 hours.
In just 24 hours. Upper and lower teeth, yes. They come in, and if we can't save their teeth, I'm a dentist, I'm all for saving teeth, but if we can't save their teeth, the teeth come out, implants go in, and then within 24 hours, we're delivering a whole new set of teeth that are fixed and permanent.
Bad gums, like gum disease, bleeding gums, bad breath. If your gums are bad, can you still do this?
Yes, actually, this is what this is for, really. I mean, the bad teeth, the periodontal disease, all of that's coming out when we're taking the teeth out. And it's really surprising because there's one patient that I have in mind, all of the teeth came out, and when he came back in the next day to get his brand new set of teeth, he was telling me how he swished some ice cold Gatorade around for the first time in years, and he didn't have any pain, he didn't have any discomfort, and just getting all of that infection out, in addition to him being able to swish that ice cold drink, he just said he felt better. So I think there's such a huge health benefit that I don't think people realize they're getting. They get that, that wonderful new smile, but there's just a big health benefit with it as well.
Now, you said that like 85-year-old, 90-year-olds can do this? Really?
Yeah. I mean, we get as young as 20, I think is probably our youngest, and we get them in our 80s all the time. And I think that a lot of people are shocked that someone in their 90s would come to get something like this, but they've been dealing with this loose denture or tooth pain for decades, and I mean, who wouldn't want to live the last decades of their life with some fixed teeth, being able to go out with friends and family, eating the foods they enjoy and not just the foods that they have the ability to eat. And I think this is a great option for anyone at any age.
Okay, now, respectfully, I say this, but I've had dentists on the show that say, if somebody's been in a denture 20 years, you can't do this, you don't have enough bone. What do you do for those people?
I think that they would be amazed to find out that they probably do have enough bone. I don't think every dentist has the same capabilities to do the procedure like we're doing. And
do you ever have to turn people away because they don't have enough bone?
I don't know that we've ever turned anyone away. There's procedures we can do now with bone grafting and things if you have to lay a little groundwork, but most people have enough bone. This procedure actually requires less bone than a procedure like snap-in dentures. So I think most people would be pleasantly surprised, again, if they could just come in and have a consultation with us. And I think they'd be happy to find out that they can have this done. Okay,
good. Now we're gonna look at those photos, but first we're gonna take a quick break. We come back, and by the way, these are kind of, I'm not trying to side with you here, but these are dramatic photos. Because I always think, look, you're exaggerating that a smile can change their whole appearance, but it's true in these. So we'll get right to that. You're watching the Wellness Hour. We'll be right back.
Are you embarrassed by your smile or tired of your messy loose dentures? In as little as 24 hours, Restore in 24 can give you back your confidence with a new permanent smile. No temporaries or months of waiting like some other procedures. Visit RestoreIn24.com or call now for free consultation and see how you can save thousands compared to other full mouth implant solutions. Restore in 24, the advanced and full mouth solution. Restore your smile, restore your confidence. Restore in 24.
I got tired of being around family and friends and not being able to smile and being able to talk. And I woke up one morning and said, hey, this is it. And coming to Restore in 24 has been life-changing. But the greatest joy I had in Restore in 24 was my 86-year-old mom. My 86-year-old mom saw my teeth. She broke down and started crying. She was, and not tears of sadness, but overjoyed that in her lifetime she got to see her baby boy with teeth that looked good.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic: getting a brand new set of teeth in just one day, in 24 hours. You can literally, according to Dr. Vaughn here, you can walk in with no teeth and the very next day get a brand new upper and lower set of teeth that don't come out. We're talking about dental implants today with Dr. Vaughn. Dr. Vaughn, welcome back to the program.
Thank you.
So that again, it sounds a little bit like an exaggeration, but that's possible. Like in 2 appointments.
In 2 appointments.
They can do that.
Yes.
You brought photos. What are we looking at?
I did. This is Janice, and Janice came to us with a complete upper denture, and you can't see that in the photo because you can't see her teeth here. But she's had an upper denture for about 7 years as of this picture, and she's in a lower partial denture. And Janice's big complaint was she's sick of eating soup, and she's tired of not being able to go out with friends and family. So she didn't want to go out and eat with people because she's embarrassed, for one, and her denture doesn't fit. This thing won't stay in. So Janice comes in, we give her a little pill, conscious sedation. She's super relaxed. We put implants in, and then here's her after.
Wow.
She's got a brand new fixed set of teeth in 24 hours. So she came in with a denture that she couldn't wear, you couldn't see, and now she leaves with this brand new set of teeth. And you can see, I mean, this is by design. These teeth, they're following her lip line. I mean, she looks amazing. I mean, she went out, she had her hair done, she had her makeup done, she's got this new set of teeth.
Nice.
I mean, this is like the big Hollywood reveal. I mean, look at the before and after.
Okay.
Would you say she looks more attractive in the after?
Yes.
She does, because a smile is more attractive than a frown. Okay, and I want you to notice something else.
Okay.
In the after, doesn't she look younger?
She does look a little bit younger. Yes, she does for
She
sure.
does.
Probably 5 or more years younger.
And you know, the first thing she did, so she's more attractive, she looks younger, and I asked her, what's the first thing you're gonna do?
What?
She's gonna go out and eat a big juicy cheeseburger because she hasn't had a cheeseburger in 7 years.
Okay.
So
That's
now
nice.
she can eat the food she wants, she can go out with friends and family, and she can smile.
When they see their face for the first time, what's that like?
I mean, she cried. She cried, we cry. I mean, this is such an emotional experience, and it's such a life-changing experience. And I think that's the big thing that people don't get. You know, they come in for different reasons, but in the end, it is truly a life-changing experience. Take a look at her before there.
Okay.
I mean, chances are she didn't like her teeth before the dentures.
Okay.
And now she's been a denture for 7 years. So she's missed out in probably a decade of not being able to smile and eat the foods that she loves.
Interesting. So is that the challenge? People put it off and put it off?
I think they do. I don't think that they, like I said, you know, a lot of people don't know about this. And someone told her that she had to have a denture. And I'm telling you right now, you don't have to have a denture.
Is that right? Are there a lot of people like in Atlanta? Because I know you draw from like 2 hours, 3 hours away. But are there a lot of people in Atlanta that have an upper lower denture?
There are. There's over 200 million Americans without teeth, or some teeth or all teeth. They're either in a partial denture or a denture. And just in the Atlanta area alone, you could fill the NFL football stadium many times over with the number of people either in a partial denture or a denture.
They just don't know their options.
They just don't know their options.
So if they all figured this out, how good this was, right? Or like tomorrow they could have new teeth. There's not enough dentists to even handle this.
There's not enough dentists.
Is that right?
That's true.
Okay, good for you. Now, training, because they don't teach a lot of this in dental school. So your team at all of your, I mean, where do you get the training?
We've had special training in something that's implant specific.
Okay.
So our surgeon actually went to school in addition to dental school just for procedures like this. And this is Valeria.
Okay.
So when Valeria came to see us, she was suffering from periodontal disease, badly broken down teeth. And what you can see in the before there is because of the periodontal disease, your teeth become loose. So her front tooth has drifted down a bit. So your eye's really drawn to that one tooth there in the front. And she just wanted to be able to smile again. She knew she didn't want dentures. She knew she didn't want
So
something.
she was headed for a denture.
She was headed for a denture.
Too young for a
And
denture.
She is much too young. Any age is too young for a denture.
Okay.
But she knew she wanted something that she didn't take out. So as you can see here in the after, I mean, this is a whole new woman.
Wow.
You know, I was showing the before after photos to my son that week, and when it came to hers, he was in awe. He said, "Oh my gosh, you know, she's beautiful." And she is. I mean, the after there, she looks more youthful, she's more attractive. It's an amazing transformation.
Probably confidence too. You said it's a big boost in their confidence.
Yeah, you know, that's why we named it Restore in 24, because it doesn't just restore your smile, it restores your confidence. I mean, there are people that, you know, they're dating again, they're getting married.
Just because of their teeth?
Just because of their teeth. And we've actually got a patient in particular that he got the big promotion that he's been wanting, and it's all because of his teeth. And his supervisor informed him of that because he's a professional, he's working alongside clients. And when I say, you know, his teeth got him the promotion, it's more than that. I mean, the new smile gave him the confidence to be able to make the sale and to be able to do those things and be more confident. And, you know, in today's times, I mean, if there's something you don't like about yourself, fix it.
Good.
Okay, and let me show you this next patient.
Okay.
This is Josh.
Oh, wow.
He was suffering from an early age in high school. So he had badly decayed, broken down teeth, periodontal disease. And, you know, he's a young guy. So it was much too soon for him to be in a denture, and that's where he was headed. So he knew he wanted something that he didn't take out. And then here's his after shot. I mean, this is an entirely new man. So, I mean, he's just, you know, in these before shots, what you don't realize is most people, and Josh included here, he has a wonderful personality, but he never showed his teeth. I mean, he's actually having to learn how to smile again. So we're forcing them to smile for these before shots just so we can see the transformation. But now, all he does is smile, and he is so happy. He told us when he came back in that I think they drove 3 or 4 hours to come see us. His wife couldn't take her eyes off of him the entire way home.
Good. Now, on his before, though, that's got to really be unusual.
The badly
teeth,
decayed.
the look, yeah.
Actually, it's not unusual at all. I think this is most people that come see us, and if they're not already in a denture, and I think what you don't realize is he's not smiling, you know.
So you just don't see it out there.
Most people don't see these people. They don't see their teeth. They're hiding their smile. So this next one here, this is Gerard. He's our musician in the Atlanta area.
Okay.
And he had some badly decayed, broken down teeth, and he got this grill to cover those teeth. Well, he's tired of the grill. It's time to get some new white teeth. Well, we took this grill off, and there's really nothing left to save. So he knew he didn't want a denture. That's where he was headed. And here's his after. And this is our Gatorade drinker, by the way.
Whoa.
So he was swishing the ice cold Gatorade that day.
And those are his teeth. I mean, they don't come out.
They don't come out. And he was in the dental chair, FaceTiming all of his friends. He was posting on all of his social media, and he is one of our biggest promoters. He could not be happier.
What do they like more in general? Do they like the new smile, the appearance, or do they like what they could eat?
I think everyone's different. The motivating factors are different, but it's amazing when they come in and just want to smile. When they leave, they're amazed at how much better they feel, how much healthier they feel. They're amazed that they can eat the foods that they want now. And, in his case, he tells us all the time, he just wanted to be able to smile again. But immediately after those bad teeth came out, he just felt better. And it's just this life-changing thing for him now. I mean, he's posting all over everything. It's truly life-changing, and I think everybody has their reasons for coming in, but it's always amazing to hear their stories after and how it's changed their lives. So this is Anita, and what you can't really see there is she's in a partial denture.
Okay.
So her main concern was her lower teeth. She only had a few natural teeth on bottom, and she knew she didn't want a denture. She had been dealing with the partial for years. She knew she didn't want a denture, so she came to see us, and we delivered her brand new lower fixed set of teeth. Before she even got home, her husband was calling us. She scheduled the very next week for us to do her upper teeth. So here she is after with her new upper and lower set of teeth. And she's such a wonderful person, and she reminds me of my grandmother. So my grandmother, she started out in the same situation where she lost some teeth, and it kind of escalated. She was a heavy smoker in her case. In her mid-60s, she lost all of her teeth. She ended up in a denture. And the one thing I remember as a child is how my grandmother completely changed at that point. We'd go out to eat. She was always the last one to finish. She couldn't eat the food she loved. There was weight loss. She used to go out on the weekends, and she had a little group that she went dancing with. She quit going out dancing. I mean, it just, her whole demeanor changed. And
when she got that denture.
When she got the dentures. I think it's just it's a big psychological, it affects you psychologically. I mean, she was different after that. And it hurts my heart that someone in my town at that time didn't offer something like this to at least give her that option.
So she never got a brand new set of teeth that didn't come out?
She never got a brand new set of teeth that came out.
But that would have been an easy one for you.
That would have been an easy one for me, and it would have made me so happy to see her be able to thrive and have the smile she deserves and be able to go out dancing without having to worry about that set of dentures.
That's a great story. And we've talked about this, but when you're on a consult with someone and they're giving you their hard luck story of what they can't eat, how embarrassed they are of their teeth, I think you kind of said that you can't help but get a little happy because they have no idea how good it's going to be. Could you elaborate on that?
They have no idea how this is going to change their life. Men come to us wanting to be able to eat a steak. Women come to us, wanting a more youthful appearance, that they don't want teeth that they take out. And when they get these new set of teeth, there's so many benefits that come with it.
Are you ever surprised, by the way?
I don't
with
think
how
that,
good they like it or how much they like it?
I don't think I'm surprised. I think we all know what's coming, and they don't know how good it's gonna be, and we get really excited.
Okay.
That's why there's a lot of crying going on. You know, they see themselves. There's a lot of emotion behind it, and it's just such an incredible experience, and we love being a part of it. I mean, every week we're having these transformations, and like I said, you know, people are getting promotions, people are getting married. I mean, there's just. I think you deserve to have a nice fixed smile. You and I take something like that for granted.
Yeah.
And I just think that they're whole again. And people around them are now able to experience the best version of them. And it's something that's been missing for some time. And this is Ben.
Okay.
Ben came to us, broken down, decayed teeth, periodontal disease. You know, he was in pain, discomfort. He was on his way to a denture, knew he didn't want a denture, too young for a denture. But like I said, always too young for a denture. This is his after shot here. And let me just tell you, the one thing that he told us is he's now taking selfies and with his children, and he's being able to, you know, present the best version of himself with his family. I mean, he didn't want to smile for his kids. And now the first thing his kids said was, "Oh my gosh, Dad's smiling." And I just think that's awesome.
You know, people like this or anybody, people with bad teeth, you say, are judged. Elaborate.
Yeah, I think people, you know, when you go to watch a movie and you see a villain or a homeless person in a movie, they typically have, you know.
They give them bad teeth.
They give them bad teeth.
Okay.
And I think people associate it with, you know, maybe you're not as intelligent or maybe you don't have money. There's so many negative things attached to bad teeth. And I think that it holds a lot of people back when they do have bad teeth. And I think having these new teeth, just it's like I said, it's a life-changing transformation because these are all wonderful people and none of those negative connotations should be attached to them.
And so this guy, maybe like on a Monday, I'm just picking, like on a Monday and then Friday he has his new teeth.
He has his new teeth Tuesday.
The next day?
Next day.
I'm even afraid you know, you call it Restore in 24, you get new teeth the next day. Like 2 visits, you could have brand new teeth if everything works out.
2 visits, brand new teeth.
Not an exaggeration.
Not an exaggeration.
Okay, good. I'm going to rush you a little bit because I know you have a stack more photos.
Yeah. So this is Craig. He came to us with periodontal disease, and you can see with the separation in his teeth, that's because of the periodontal disease. The teeth become loose, things begin to separate.
Okay.
He was on his way to a denture, knew he didn't want a denture. Here's his after.
Whoa.
I mean, this looks like a brand new man.
Yeah.
He was going to Cancun on vacation, so hopefully he had lots of nice pictures.
The guy in Cancun with the great smile.
That's right, that's right.
That's one of Dr. Vaughn's patients. Okay,
that's
good.
right. And here's Josh.
All right.
Josh came to us, periodontal disease, separation of the teeth. He was already in a partial, and he knew he didn't want a denture. He had been dealing with the partial, didn't like the partial. He and his mother came in for the delivery. There's his final set of teeth, and this.
Looking good.
This is one of our favorites. His personality is contagious. This is John. John had an accident earlier in life that it caused some of the teeth, you know, to break. Then they decayed. He had some periodontal disease.
So his upper teeth don't even show.
Yeah, his upper teeth don't even show. And so in this situation, a denture would have been an option, but he knew he didn't want a denture. He knew he didn't want something that he could take out, and he didn't want something that went across the roof of his mouth. And here's his after.
Wow.
And now all he does is smile.
What a difference.
It is. It really does make a difference.
Because you told me, we talked in the green room, that people become more handsome, more attractive. It's true. I think anybody looking at this, it's the truth.
There's a whole new social life that goes along with this too. You know, I'm thinking of some of the men that have come in. They've got a whole new social life that comes along with it. Here's AC. AC, periodontal disease, broken down teeth. Knew he didn't want a denture. He wanted to be able to eat the things he wanted to eat and not just the things he can eat. And then here's his after. All he does is smile. Now he can hang out with his friends, his family, and not worry about it.
They can eat literally anything?
You can eat anything.
Could you, like, let's say beef jerky. Could you tug it out of your mouth? I know you don't want them to do that, but you could.
You could do that. Yeah, these things, I mean, you know, they're secured by the implants, and the materials that we have today are stronger than any of the older traditional materials. This is Kelly. Kelly came to us, you know, she's kind of the typical mom story we get. You know, she took care of the kids, didn't take care of herself like she wanted to. Now it's her turn. She doesn't want dentures. She's on her way to dentures. And here she is after.
Oh my goodness.
And her son is just in awe by her new smile. And, you know, she did a little video for us and showed us some of the selfies that she was taking with her son for the first time in decades.
So when I see these obnoxious people on Facebook that are selfieing 3 times a day, they might be some of your patients.
They might be some of our patients. Absolutely.
They can't get enough
why
of
wouldn't
themselves.
you? Share it. Share the smile.
Okay, good.
This is James. James came to us. He was already an impartial. He knew he didn't want a denture. He didn't want anything that you could take out because he had been dealing with the partial. And here he is after, and I think you can tell that he is happy with his new smile.
You can. You
He
can.
is happy with his new smile. And this is Angela. Angela came to us, you know, even trying to get her to smile for us for that before shot. She doesn't really want to show her teeth. And then here she is after. She has no problem showing us that new smile.
That is a pretty smile.
That is.
So you say, like, for example, with this, like women have different curves of their teeth and men have different.
Yeah, so, you know, we always want
That's
to
a
try
feminine
to...
smile.
It is, and you know, there's a lot of little characterizations we can do to these. So this isn't just a cookie cutter approach. There's different teeth, different shapes, different sizes. We're looking at your face, your smile, and we're designing something specifically for you. And here's Sean. Sean came to us with several missing teeth on the upper and lower teeth. He knew he didn't want a denture. And then here he is after, in his pearly whites, brand new smile. Couldn't be happier.
And so for maintenance, they just go in for their 6-month
Yeah, you know,
checkups, brush, floss, or do
typically
whatever.
it's once a year. You come in once a year. We take a look at your bone levels, just make sure everything looks good, see how you're doing with your home care, and it's a very quick, simple annual visit.
Okay, good. Somebody watching this, and we're out of time. They're one of the two groups. They either have a denture or they're headed to a denture with really bad teeth and gums. Let's say they've heard what you had to say, but for whatever reason they're afraid or they're skeptical or whatever. What do you say to them?
I think that you just need to come in and have a conversation with us. You know, we offer a complimentary consultation. We're going to get that 3D image. We're going to be able to go over the options with you. But I think if you've been elsewhere and they've told you that you're on your way to a denture or a denture is really your only option, I think you owe it to yourself to at least come in and see us, because I think you're going to be pleasantly surprised at what you learn.
Now, Medicare, Medicaid, even the best dental insurance covers a small part. You say people are financing this.
The majority of people
Really?
finance, yes. Some people don't require financing, but the majority of people are financing, and we work with some local banks. So it's a very simple thing for us to just put you in touch with the bank, and we'll walk you through it every step of
And
the
you
way.
say you're less expensive than the so-called leaders in this industry.
We are. We are very competitively priced, and I think that we offer a very personal touch. You know, I mean, we will literally hold your hand every step of the way. We know this is a big investment, and I always want you to be super comfortable when you make the decision to come see us.
Dr. Vaughn, thank you for coming on the show. Good stuff.
Thank you so much for having me.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.